Hello everyone, Dr. Kimball here. Today I want to give you a little bit of information about recovery. Now, I recommend surgery to my patients on a weekly basis for different problems that I've been following them for, and without any exception, everyone has the exact same question, and it's a very open-ended question, and you're probably thinking about that too right now. Okay, your doctor has recommended this surgery. The next thing out of your mouth is going to be, how am I going to deal with this? How's it going to work with my family schedule, the other activities that I do, and my work schedule, and when are we going to, how long do I need to be off work? You want to know, what's the recovery like? Okay, so that question is a whole big can of worms, and when I hear that question, I kind of smile every time, and my response is the same. Before I answer that question, can you please tell me what recovery looks like to you? What level of activity are you talking about recovering to? Are you talking about, I need to be able to get back to working my desk job, I need to be able to drive, or do you perform some task or have some home or family responsibility that you need to be able to recover to so that you can, continue to function in your normal life? That's what you're thinking. I don't know what you're thinking. So you got to communicate that to me or to your doctor. They need to know what recovery looks like for you. So you might ask instead, hey, how long is it going to take me before I can get back to going to work and driving myself to work? How long until I can take my collar off if you have to wear one? When can I go skiing again? Or when am I going to be able to be hiking? How long before I'll be able to walk 2 miles without stopping? When can I take a shower? All those are more specific recovery type questions. I've had patients that have had simple surgeries and they want to know, when can I get back to work? And I say, okay, what kind of work do you do? And I share this example with my patients all the time. This particular patient said, well, I climb trees. He's one of those guys who scales up trees and is cutting the branches down so they don't fall on telephone lines and things like that, electrical lines. So that's a pretty aggressive job, a high-risk job, and he had just had neck surgery, and I was not super enthusiastic about him getting back up on a tree and putting himself at risk and disrupting the surgery that we did, and that would not be good at all. So if you're trying to get back to driving, the things that I tend to think of with recovery are, when can I get back to driving? And my natural response is, regardless of the intensity of the surgery that we're doing, I want people to be able to walk a mile without any aid, and 2, to be able to get through a day or half of the day without taking any narcotic pain medication. Those are 2 simple things. I don't want you driving when you're doped up on pain medication. I think most doctors would agree. And 2, you got to be able to get in and out of the car on your own without assistance. If you need someone helping you out of the car, you probably shouldn't be driving. I don't love the idea of patients wearing a hard collar when they're driving a car. I think that limits your ability to look from side to side, and it's not safe. If I saw a patient, and I have on occasion seen patients driving in collars, not necessarily my patients, but it's a little frightening to me because I know they have a hard time turning and looking. So you can go to work and wear a collar. You can go to work and wear a back brace. It might be nice to be able to have someone driving you to work, or take the train or whatever it is. There's different options out there, and I think there's good ways for you to get back to activity as soon as possible without overdoing it. All right? So there is this gray zone where you're not fully recovered, that we really want you back to work. I find that patients that get back and reintegrate back into their normal mode of life in a very reduced capacity, they end up doing better long term. So my goal for you is to get you back in action as soon as possible, but to do it in a safe way. If you have further questions about this, what you can do, what you can't do, please reach out to your doctor. If you want to know what I do with my patients, please leave a comment below. If you have other questions about spine surgery and recovery, I'd love to hear them. Please add it to my Facebook page or my YouTube channel, and we'll try to get back to you.